Joining us now is Will Humble, former director of the Arizona Department of Health Services, now executive director of the Arizona Public Health Association. Mr. Humble, you were here early on to talk to us about things seeming to go off the rails in Arizona. What you said at the time early on was right. But I have to ask you, if you knew that it was going to get this bad this fast, or if you are among those who is surprised at just how out of control things got in Arizona.
Let me think about that. I knew things were going to get bad. You asked me at how soon. I thought it would probably be sometime in July, but I'm now confident that we'll be in crisis standards of care within the next few days, if not by the end of the weekend. I mean, it's gotten so bad so fast. And the reason is, because the public policy that we developed and that was used at the end of the stay-at-home order really set in an honor system. And an honor system isn't adequate to direct the kind of human behavior that we need to slow down the spread of this virus. And so that's really what happened. Is this is directly related to policy decisions that have been made. This is not bad luck. This isn't anything like that. These are directly related to policy decisions that happened in this state.
Can you explain in layman's terms what you mean by crisis standards of care? I know that's a term of art in terms of public health and the way that hospitals think about this. But for those of us who aren't fluent in that language, can you explain what that means?
Well, a lot of it has to do with how you triage patients and how you decide which patients get what kind of care. And so there's a protocol that we have in place in Arizona that provides guidance for doctors about how to make those decisions when there's inadequate resources to treat everybody that's in the hospital. And so it's actually a scoring system, and all states have this. Part of it is how acute is the illness that the person has? How risky is it that that person is going to end up in multi-organ failure? And the other part of the equation is how old is this patient? And if they recover from COVID, how many years or months would they likely have left anyway? And so crisis standards of care, you combine those two parts of the equation to come up with an algorithm to decide who gets care and who doesn't.
And in terms of not getting care, you mean people who are in the hospital now getting discharged to make room for more people, or people turning up sick and being told, sorry, there's no room at the inn?
Well, it's all of those things. And so, like, for example, if you would have gone into an emergency department under normal circumstances, they might say, let's send you upstairs to an inpatient bed and watch you for a couple of days so you could get better care. When you're in crisis standards of care, you might just be sent home from the ED when you normally would have gotten a bed. Likewise, when you're in a hospital bed, under normal circumstances, if you start to deteriorate, you might get an intensive care bed because you need that kind of care. When you're in crisis standards of care, you triage who gets that ICU bed. And so you might end up staying on a regular hospital floor when normally you would have gotten that more intensive care. And so the standard of care changes when you get into surge status. And I think it's important for everybody to know in all the states, as your governors and elected officials make decisions, that when they start talking about using hospital capacity as a control measure, as an endpoint for how they're going to manage this epidemic, start worrying. Because what you really should be doing is putting together policies in place to change people's behavior, to slow the spread of the virus so that you don't end up like us in crisis standards of care.